Vanessa and Enji Sagamok Anishnawbek. It is a day that we've looked forward to for a very long time. I have prepared words that I will share with you after the minister's announcement this morning. We do have a couple of speakers who will speak and share with us as well too. But I do have a presentation that I do want to make when I finish my words this morning. Certainly, the journey to reach to where we are has been a long one. All of this work started years and years ago. I'm reminded of the words that Christopher Gaabwitadaaying shared with Chief Paul Shkokagan on his vision for a place where we can go for healing. There's still much work to be done to pursue that vision. All of these achievements that we reach are steps along that path to a community that is well, to a community that embraces each other. Yes, we have our challenges, and there's no doubt for me that this period in time of working for you in this capacity, in this responsibility, has been difficult. On top of a global pandemic in our community, we were also suffering through an epidemic, and we continue to. And there's many times where my heart was there in those times when we said goodbye to our loved ones. And many of us had to stay home because of what we were going through in our community, globally. But we can start to see that light moving forward. But what we ask ourselves is not to dwell on the negativity of it. What have we learned? What are we to learn from those times that are challenging, that we find challenging for us? And that is what I challenge myself to every day. Despite our difficult times, what is to be learned? It's easy to cast blame. It's easy to say something is somebody else's fault. This is where I'm at because of. But what am I doing to guide my way forward? What am I doing to help others? What am I doing to share the love I have for my community? What am I doing to let people know I love them? That is a hard word for us because it wasn't that long ago we weren't allowed to say that. Not to go off on a tangent here, but I'll share with you very briefly some of the other things that we're pursuing here to try and seek wellness in sharing our truth. Seek wellness in saying what we need to say. Many children from our community left. And the count that we know of is in excess of 90 kids from our community that went across the river. Some never came back. But that impacted us. Because at the time, when you think about the population of our community, that's about a third of our community that had left at that time. And many came back carrying the difficult memories of what they experienced. And we still carry that today. My dad went to school there. And one of the things that I recall him sharing during his journey, his wellness journey, was one of the regrets he had was that he never got to tell my grandpa, his dad, he loved him. He was angry with him. He was angry with him because he blamed him for not doing enough to keep them from taking him away. He was angry with him because he didn't know if he was the one who sent him away. He didn't know because he didn't have that conversation. When I heard that story, and as an adult, I started to think about what is it he wants to hear. So when he was lying in his bed before he passed, I apologized to him for the way I behaved to him when I was younger. Just because I went to school thinking that I was smarter than my parents, thinking that I could speak to them in a way that was condescending to them. But there were certain things that I said to them that they found difficult to accept, to hear. Because after I heard my dad share that story, I said to him, I laid beside him, I said, I love you. And I didn't hear back. He just said, okay. But that's a word that we cannot be afraid to share today and moving forward. Share it with your parents. Share it with your children. Share it with your siblings. That is part of the journey moving forward. Is being able to say these words that we've found difficult for such a long time. We have many who are still going through a difficult time. And that's why we have our announcement here today, because the community has spoken. This is going back years in terms of the vision that Christopher had for our community and the community movement that had started early 2000s. We've had many, many meetings. We've shared a lot of what our challenges were and have been and continue to be. The announcement today is going to allow us to take another step in that wellness. We have to know it's not going to come along and take everything away for us, because that comes from each and every single one of us deep down inside. For those of us who've embarked on a healing journey, it just doesn't end with one ceremony, 2 ceremonies. No, we have to keep working at it every single day. Giving thanks for what we have. Giving thanks for all of our teachings in the good times and the difficult situations for which we learn. Give thanks for those around us who provide that support. Because no matter where we are in life, if we feel that we're doing well, or if we're at the bottom of where we feel we are, share with all that there is somebody, and there's many who love them. That's what I ask of our community to share amongst and with each other. Share those true feelings. Don't be afraid to say that. And those who are suffering, let them know. When we embarked on this journey as a community, to begin to look at what do we need to do. As I mentioned, it took years and years to get here. It didn't come with just a proposal sending into the government. This took a lot of energy. This took a lot of commitment. And we asked ourselves at times, well, what are we doing it for anyways? Like, what's to become of it? We know that when we share, that is a part of that healing. When we're speaking with others, that's helping somebody as well too. In the over time, we've done a number of studies, and why I mention that is because I've heard the words, well, we did this Vision 2020, well, it's 2021, what have we done? We don't just do a proposal and a plan and then let it think that it's going to carry out on itself. No, we all have to know what that is and what that plan is and ask the question, what is my responsibility? What is my responsibility to my family? What is my responsibility to my community? So it was a long journey, and that when we look at pulling everything together, I think of some of the events that led up to the relationship our community developed with a gentleman who was making the announcement today to share his efforts, his commitment, and that the love that he developed for our community. He worked that much harder once he got to see what we're experiencing. We showed him the good times too. We brought him up to the harvest. We brought him to come out hunting. It was fun, to say the least. Didn't see anything scared every single way though. But, I want to share with you the significance of what this responsibility has displayed to me in a way where I understood better, I can't say it fully, the significance of ceremony. Because along that journey, something significant happened. An eagle came to our community. We had ceremony for it. And those feathers are being shared. In that ceremony, it was that eagle would help us with what we're going through in our community. I'm going to admit something to you. When I came into this responsibility for this community, I had my thoughts of what I thought I was going to do. I had my thoughts of what I thought out to be. And everything, and that was the furthest of what was. Because things started to happen, which I found myself being guided in how to pursue this responsibility to you, the community I love. was guided very much so by ceremony. And I was asked that question too. Why are you doing so much ceremony? You were never like that before. I just respond, well, I'm doing what I'm being told to do. I'm doing what I'm guided to do. I don't fully understand it, but I respect it enough that I listen. A time when we invited our friend, who will speak shortly, Minister Michael Tibollo. We invited him to, we spoke about our plan, what we wanted to do. And we invited him up to Ritchie Falls. We took him and his wife out fishing. We went and picked berries. We went and picked Labrador tea. And we shared with him, this is what we do with these. And then the next morning we had pancakes with blueberries in them. And they really appreciated that. That started a bond with that individual in our community. And I didn't fully understand the significance of that relationship at that time, in terms of how things would move forward, because I had my own thoughts and perceptions of what government would do. And often, unfortunately, it's lip service. They'll tell us we'll do this, we'll do that, and then we sit and wait, and then nothing happens. But this individual, our community met, was truly touched by what he experienced with our community. He had the opportunity to meet with many of us, the grandmas and aunties, grandpas and uncles, Sacred Spirit Sisters, our fall harvest. And when he joined us on this trip I mentioned last summer, he and his wife were traveling up. We're pulling some equipment, and then a red-tailed hawk ran into the windshield of one of the vehicles. And that's significant because I'm very certain that was the very same red-tailed hawk that gifted Yulon with a feather not more than 2 weeks before that when we were up there. We were driving along the road, and then I thought it was an eagle at first that was starting to ascend. And then when we came up to it, I slowed right down, and then we were looking at it, and then it flew right over us. And all of a sudden, the feather came down, circling down, landed right in front of us. Went out, put tobacco down, picked up the feather, and we took it. And then we didn't quite know what that meant at that time. So when we traveled up there with the minister and his wife, a couple of weeks later, that hawk ran into one of the vehicles. And it was difficult because it was still alive, and what do we do with this? And then I was trying to capture it, and then so I knew the minister and his wife were in a hurry, so they had to get back home. And so I said, okay, well, let's just keep going, and I'll come back and look for it. And I did that. What I asked as well, too, an elder, what was the significance of it? Because it was very significant incident. And he said it was telling me something to slow down because there may have been something up ahead. Either you, Yulon, or the minister, because we had spent time there trying to retrieve the bird, and so because we were all in a hurry to get going that day, so it made us slow down. So I went back and I retrieved the red-tailed hawk, and then I managed to capture it, and it let me take it without struggling with me. And it came with me, and then I took it to a place in Valcarin. He was coming back up in the fall with his family. we had invited him back up, and I was excited because I wanted to share news about the red-tailed hawk. But that morning, I ended up going out back on the grid, and I got online, and then I contacted them in the south and asked how the bird was, because I wanted to give an update to the minister. I thought I'd see a day where we would go back there and let the bird go and fly. They told me that they were trying to get a hold of me. They had to make a decision that yes, the bone was fixed, but the tissue had deteriorated where it was starting to rot inside, and so they had to put it down. So rather than break its spirit by taking off its wing and living with one wing, they put it to sleep. I drove back up. The significance of events really touched me that I cried. I went back up and I shared that with, and the minister was already there, and then so I shared that with him, what happened. But right away, this other individual came to mind, medicine man. So I kept that bird in the freezer, and I waited for him to come to the area. And when we had ceremony, and I gifted him with that bird, and he was emotional because he said it was the start of the 4th stage of what he needed to go through, and he had been pushing it away for a long time, even going through a difficult time in his life. So when that, he told me that when that bird came to him, he said that was his signal. And when we had that bird in ceremony, I found myself very emotional again because that bird was flying around in that ceremony. When we think about what that bird is going to do, it is going to help many. It is going to help thousands, because that bird will be part of that ceremony that will help many people who go to that medicine man for help, because that is a part of his bundle and what the work that he needs to do. So, and actually while I was speaking, I was trying to find time to, when I started at 20 to 10, I knew the minister was going to be coming on at 10 o'clock, so I guess he's waiting. And so, but I wanted to share that with you in terms of these significant events that happened in our wellness journey. And I wanted to share with you the work that we need to do ahead of us. It's going to be hard. It has been hard, and these journeys are hard, but know deep inside that we are committed to it, because our children's future depends on it, because we love our children. So I'm going to share with you a statement. I know I spoke long, but I do have some words I want to share with you after, as well as a presentation. But
okay, we have the minister online. I'd like to welcome you to come on board with us, Minister Michael Tibollo, Associate Minister of Mental Health and Addictions. Welcome.
Thank you, and I guess we can get started. Good morning, everyone. Bonjour, Annie. Miigwech, the Chief, Gimaa Ozawanimke, Tammy, Mayor Jill Beer, Jane Batistelli, Joanna Henderson,
Recording in progress.
And everyone that's joining us here today. As the province's first minister responsible for mental health and addictions, it gives me great pleasure to be here to share some great news with all of you. For those of you who may not know of my background, addiction is an issue that I've a very close and personal connection to. Prior to taking office, I spent several years as the chair of a bed-based therapeutic community, where I eventually became a certified addictions counselor. During this time, I've worked on the front lines helping many individuals who are struggling with their mental health and their use of substances. And since I've had the privilege to serve as the province's very first minister responsible for mental health and addictions, I've heard many stories of Ontarians in the north struggling with addictions and mental health, including so many in Espanola and the surrounding region. This includes many Indigenous peoples and communities. For almost 2 years, families, businesses, and communities across Ontario have faced many challenges and unpredictable situations, unlike anything we've seen before. The pandemic has truly tested our collective resilience, and we know it has only led to new and more complex challenges for those living with mental health or addiction challenges. As many of you know, the number of deaths attributed to opioids has more than doubled during the pandemic. And we know that 116 First Nations people have lost their lives due to opioids in the first year of the pandemic, an increase of 132% compared to nearly 70% among non-Indigenous Ontarians. And there's been a growing need for high quality and culturally sensitive addictions care across the province, particularly in rural, northern, and Indigenous communities. And that's why I'm so proud to announce here today that our government is investing over $1.2 million through the province's new Addictions Recovery Fund to immediately enhance access to bed-based addiction supports in Espanola and Sagamok Anishnawbek First Nation. This funding will provide access to a total of 10 new treatment beds and help hundreds of Ontarians in Espanola and the surrounding region access specialized addictions treatment. This means those struggling with addictions challenges in Espanola and the surrounding region will have access to one new withdrawal services bed that's also known as a detox bed, and one new supportive treatment bed at Espanola Regional Hospital and Healthcare Center, and 8 new addiction treatment beds located at Sagamok Anishnawbek First Nation. Services here will be Indigenous-led and will provide culturally sensitive services for Indigenous clients. On top of all this, and I'm really proud to have seen and to have participated in some discussions during the summer, there'll be funding through our new Addictions Recovery Fund to support a brand new Indigenous-led youth wellness hub to provide culturally sensitive supports for Indigenous youth ages 12 to 24. This incredible project is the first of its kind in Ontario and will be led by Sagamok Anishnawbek First Nation in partnership with Youth Wellness Hubs Ontario, led by their CEO, Dr. Joanna Henderson. Today's funding is part of our investment of $90 million over 3 years through the new Addictions Recovery Fund, which is supporting almost 400 new addiction treatment beds across the province and helping to stabilize and provide care for approximately 7,000 clients per year. The Addictions Recovery Fund investments across the province will also provide services and supports through 8 new youth wellness hubs for youth ages 12 to 25, 2 new mobile mental health clinics that will provide services directly to people living in remote, rural, and underserved communities, and 3 new police-partnered mobile crisis response teams. I'm also very proud that the Addictions Recovery Fund will provide support for Indigenous-led land-based healing facilities, building on the more than $41 million we've already invested for Indigenous-specific and culturally sensitive mental health and addiction supports through the Roadmap to Wellness. And we're also investing in additional community supports, including day and evening intensive treatment, mild to moderate intensive treatment, and aftercare programs to finally take the next step towards building a continuum of care in every community across the province. Today's announcement is a major step towards building a connected, client-centered, and fully integrated mental health and addiction system that works for all Ontarians whenever and wherever they need support. It's truly been a great honor to join all of you here today, and I want to say miigwech to everyone here for your help in making all of this possible. I know that with many of the conversations that I've had during my visits to Ritchie Falls and to Sagamok, I've learned a great deal from the elders, from the chief, and from many people now that have become friends. There's a great deal of work for us to do, but I know together we can make a difference and truly help people close to home get well, and be able to enjoy their life to their full capacity. Thank you so much. Miigwech.
Miigwech, Minister. Our next speaker is Jean Batistelli. Is she on? Okay, go ahead.
Good morning, everyone. Ani. I would like to thank the Honourable Minister Tibollo, Sagamok Chief and Council, and the entire community for including Espanola Regional Hospital in this announcement. We are extremely grateful for Minister Tibollo's support and our government's commitment to the health and well-being of our rural community. Through the support of Espanola Mayor Jill Beer, she was able to bring forward challenges our community is facing in providing acute addiction services to Minister Tibollo, and we are thrilled her advocacy has supported this funding. This investment is a huge first step in building local capacity for dedicated addictions beds in the acute care system, and will allow us to develop the skills, the competency of our clinical team to provide evidence-based, high-quality medical management for those withdrawing from substance use. The opportunity to further partner with Sagamok to create culturally safe programming and strengthen care pathways is essential to creating a more connected and comprehensive care continuum for patients and communities we serve. We are extremely appreciative of the opportunity to improve patient care closer to home and for the ability to make the difference in the lives of those who are struggling with addictions. On behalf of our organization, thank you, Miigwech.
When you look out on a crispy morning and see the sparkles of light dancing in the air after a winter night storm, or a morning when you see the sparkles of sunlight shining in the mist after a rainstorm, I'm told that the light sparkles in the day is called Ngwaseak. For us, we can interpret the sparkles of light as glimmer of hope. For our community shares that we are getting a family treatment center this year. We will be facilitating Ritchie Falls Resort into a place that supports individuals and families affected by substance use. With it comes a culturally grounded model of care that comes from our community and mindfully address the root causes of substance use for people in our community. This announcement brings a vision in our community to a tangible reality. We owe this new reality to the hard work of our people. As individuals and families, we came together and shared our experiences with substance use. We had conversations of what we needed to do to support our individuals and families who are struggling. Together, we came up with a plan. And with it, we developed a family treatment model that is suitable for our community members. While the Family Treatment Center program model was informed by the needs of the community of Sagamok in its development, acceptance into the center's programs will be inclusive of Sagamok Anishnawbek community members as well as others from other communities and the community at large for whom the program may benefit. The program will be known as Ngwaseak, honoring the memory of Cherise Sterling Owl, our sister, mommy, cousin, auntie, and Adonis. Ngwaseak is Cherise's spirit name that came from ceremony. We acknowledge elders Keith Busno, Martina Ozawanimke, and Mary Elliott for going into ceremony to receive her name. And I have to share the significance of that because they went to 3 separate ceremonies. In 3 different locations, they came out with the same name. As I mentioned earlier, Gosaic describes those cold, crisp mornings of winter when you see ice crystals of frozen moisture suspended in the air, shimmering and dancing in the sunlight and reflecting all the colors of the rainbow, or the droplets of sparkling rain on a sunny day. When we speak of Gosaic, we think of a glitter of hope when we see that shimmering array of dancing light. We acknowledge Gosaic's mother, Charlene Sterling Owl, for her tireless efforts to draw awareness to the harms of substance use and call-outs for our community of the harms of substance use, and work together towards a safer community that offers the supports people need to live healthy and well lives. We acknowledge Grandma Leona and Grandma Charlene as they raise Gosaic's babies, Rory, Paisley, Holly, Charlize, and Oakland, to fondly remember their mom and to have the tools and skills they need to live healthy lives. We acknowledge our community members who have both inspired and driven our community response to the ongoing challenges our people and families face in relation to substance use. We thank our people who came out to share their experiences, going back generations and documented back to our early community conversations, the community story sessions, the Alcohol and Drug Summit in the late 2000s, our strategic service frameworks and strategies, Vision 2020, the numerous surveys and engage in conversations. We acknowledge the work of our Sagamok Anishnawbek administration for listening and hearing what our community was expressing, sharing their experiences and what we believe will work for our people. Unable to attend today, we acknowledge Fern Sinaway, who was instrumental in bringing people together in a collaborative spirit devoted to the wellness of our people. At the same time, we also acknowledge those who supported our work in our mental health and addictions team during the early times, with special mention to Yolan Nashwa, Jennifer Lalone, Wayne Southwin, Brad Polson, Christopher Weatherly, Yvonne Ebton, Bernadette Southwin, and those who are there today to continue this work for our community. We also acknowledge our partners, Dignitas International, the CCS Group, and Vanessa Seawick for their assistance in developing a proposal with Fern, Nicole, Anna Marie, Brenda, Yulan, Tammy, Paul, and Lorraine for a family treatment center feasibility study and project plan to deliver it. We acknowledge our leadership, both current council and past, for envisioning the path forward for our journey of community wellness and enabling the work that led to today's announcement, with special mention of Gimaa Paul Shkokagan and council, Gimaa Nelson Toulouse and council. They brought people together to assemble what we needed to reach our goals. I want to thank Indigenous Services Canada, First Nation Inuit Health Branch, Ontario Region, for their financial support of $1.125 million that will help us facilitate our Ritchie Falls Resort to accommodate the Family Treatment Center. And again, Chimigwech to Minister Michael Tibollo for his announcement today on having 8 beds available for us at Ritchie Falls for our treatment center. Our community gives special thanks, very deep special thanks, to our friend, Associate Minister of Mental Health and Addictions with Ontario's Ministry of Health, the Honourable Michael Tibollo, for his heartfelt support, tireless advocacy, and for sitting with our elders, our grandmas and aunties, our sacred spirit sisters, and our grandpas and uncles, to hear what it is that they need. what our families need in order to succeed. At this time, just before I close, I want to take a special moment of silence to honor those who we have lost along the way to substance use. Think about them. Those families who have been hurt and are still hurting. Those who continue to struggle today. Those of us who continue to struggle with the deeper unresolved grief and trauma of our history. And the bravery of those who have shared their experiences, contributing to a vision for a thriving community of families. So before I close, I want to have a special moment of silence to honor those. Before I close, I want to have a special gift for Charlene. And this was the eagle I spoke about earlier that came to our community. And I gift this feather to Charlene in Sharice's honor. And we pray that and know that Sharice is going to be with us when we do this work. We know, and those who have succumbed to that challenge of the substance use in their journey here, we pray to them and ask of them for their guidance and support in the work that we do moving forward for our children in our community. Charlene?
When I received the telephone call from Gimaa, and my heart was touched. Last 16 months has been really difficult. Hallie's now home with me, and so I've been raising her, and we take it day by day. It's really exciting. The vision boards that are on the wall, it just warms my heart. That healing, I really believe healing is gonna come within our community, and my heart is to help others, and I see a lot that are struggling the same way Sharice struggled, and change and healing. And I'm now working with the mental health and addictions team, and that's where my heart is. And I look forward to moving forward and helping any way I can, and being a part of this journey. Thank you much.